Welcome back. Now we're going to start talking about some licenses, and I'm going to start talking about British Columbia. So in British Columbia, they do have a practice-ready assessment program for family medicine. They do not have a practice-ready assessment for specialists, okay? So we are going to talk now about the practice-ready assessment for British Columbia. So the program in British Columbia has a few things that might be in your advantage, okay? So the first thing is that the practice ready assessment in BC, since, if I think about it, since 2023, they do not require you to have sat the NAC. So you do not need to have done NAC. So NAC is the National Assessment Collaboration, which is basically an OSCE, which is an objective standardized clinical assessment or examination that will assess your ability to practice or perform clinical procedures, okay? So we'll assess how you do history, physical examination, and some other things like that. So it is an exam that is more challenging to book, it's more expensive as well, and it only happens twice a year, so a lot of people might not have done it. It is still a requirement if you're applying for CARMs and for many licenses, but you can do the practice ready assessment in British Columbia without having sat the NAC, okay? So that is now the first thing that I want to talk about, which are the exams. So you do not need to have NAC. However, you will require to have the MCCQE 1. So you need a past standing on the MCCQE 1 when you apply for the practice ready assessment in British Columbia, okay? Now, the second thing I want to talk about is whether or not you're going to need to do the TDM. So the Therapeutic Decision-Making is a requirement for most of the practice-ready assessments in Canada, and in BC it's no different. However, the TDM, although it is also an examination, you can only do it by invitation. So once you pass the screening and they invite you for the program, they will invite you to also sit the Therapeutic Decision-Making exam of the Medical Council of Canada. Okay, so this will probably be required. Number 3 is immigration status. So it is much easier if you have PR or if you are a citizen, but they do mention on their website that they might be able to help you with the Provincial Nominee Program for BC if you're eligible for everything else, okay? Otherwise, you would need to have your permanent residency or be a Canadian citizen to be able to continue. Now, when we talk about currency of practice, that is important, and that's why I told you that you need to know about your gap. And on your template, you probably took notes already of what is your gap or how much you have practiced in the last 3, 4, or 5 years. To be eligible to apply for the practice ready assessment in British Columbia, you need 960 hours of practice in the last 3 years, okay? So in the last 3 years. So this amounts to approximately 6 months of full-time work, okay? So 6 months full-time. And it doesn't have to be continuous. So when you look over the last 3 years, as long as it adds up to 6 months full-time and you can prove that, you would be eligible as being in practice. If you are not in practice, or if you've been more than 3 years out of practice, then you would not be eligible to apply for this license until you break the gap. Okay, so that's something else that I would like to mention. In terms of your postgraduate training requirements, BC still requires 2 years of postgraduate training, okay? That means that just the internship is not enough. You will need to have internship in 1 year of family medicine training or 2 years of family medicine training, okay? Some specialists may have done like a 1 year of like the PGY1 being very basic, and that will have similar to family medicine. Sometimes that can compensate, and you can use that 1 year with internship to try to reach the 2 year requirement. But you do need 2 years of postgraduate training to be eligible for a practice ready assessment in British Columbia, okay? And finally, the last thing is your experience, okay? For British Columbia, you must have at least 2 years of independent practice experience. I'm going to abbreviate it as IPE. So you need to have 2 years of independent practice experience to be eligible for this license, okay? So in summary, for you to be able to apply for the Practice Ready in British Columbia, the Practice Ready assessment in British Columbia, you must have the MCCQE 1. You must have practiced 960 hours in the last 3 years. And remember that doing online clinical assessments or seeing patients through virtual means do not qualify as being in practice, okay? So for the purpose of the Practice Ready assessment, you need 960 hours or 6 months out of the past 3 years that you were practicing in person, okay? So then you're gonna look at your training. You need 2 years of postgraduate training, and then you need 2 years of experience. If you have these requirements, then you can apply for the Practice Ready assessment in British Columbia. As most provinces, it does come with a return of service, but what's most important is that at the end of the program of the assessment, you would be able to have a provisional license, okay? So just to remember that Practice Ready assessments is, as the name says, an assessment that lasts 3 months, okay? So it is not a training program, it is an assessment, and basically you must pass or be considered that you are ready for practice at the end of this 3-month mark, okay? If you're not and you fail the Practice Ready assessment program, it doesn't matter in which province you failed, you can only try once again in any of the other provinces in Canada, okay? It is an assessment, as I said, so they're not going to be training you or helping you grow, like in terms of getting ready for the exam. It is in itself like an exam. You're going to be assessed on your ability to be a family physician that will be ready or not to practice independently, okay? So this is the Practice Ready assessment in British Columbia. Stay tuned because I'm going to talk about other licenses in British Columbia and also about the Practice Ready assessments in other provinces. If you have any questions, please leave below in the comments.